Most people grow up believing that if a medication is prescribed or sold over the counter, it must be safe. That belief feels logical and comforting, and for many years, it goes unquestioned. But as the body ages, the way it responds to medications changes in ways that are often underestimated. What once worked smoothly in your 30s or 40s can begin to place unexpected stress on your system after 60. This is not because medications suddenly become bad, but because the body processing them is no longer the same. With age, the kidneys filter more slowly, and the liver breaks down substances less efficiently. This means medications can stay in the bloodstream longer, build up in higher concentrations, and produce stronger or unintended effects. At the same time, the heart and blood vessels may already be under strain due to natural aging, high blood pressure, or other chronic conditions. When these factors combine, even common medications can quietly increase the risk of serious events like heart attacks or strokes. One of the biggest hidden issues is not just a single medication, but the combination of several. Many older adults take multiple prescriptions along with over-the-counter drugs and supplements. Each one may have been given for a valid reason, but they are rarely tested together in the same body. The interaction between them can amplify side effects, disrupt heart rhythms, or place extra pressure on the cardiovascular system. This overlap is where risk often hides, not in obvious symptoms, but in subtle changes that go unnoticed until something serious happens. Pain relief is a common example. Many people rely on widely available anti-inflammatory drugs to manage joint pain or stiffness. These medications can seem harmless because they are easy to buy and have been used for decades. However, regular use can lead to increased blood pressure, fluid retention, and changes in how blood clots. For an older heart, this combination can create conditions that make a cardiac event more likely. The danger is not always immediate, which is why it often goes unrecognized. Another area of concern is medications used to control blood sugar. Some older types of these drugs work by pushing the body to release more insulin, regardless of current needs. This can lead to blood sugar dropping too low, sometimes without clear warning signs. In an aging body, such drops can trigger irregular heart rhythms or place sudden stress on the cardiovascular system. What might feel like a minor episode can quickly escalate into something far more serious. Mental health treatments also require careful attention. Certain medications can affect the electrical signals that regulate the heartbeat. While this may not cause problems in younger individuals, older adults may be more sensitive to these effects. Even slight disruptions in heart rhythm can become dangerous if combined with other medications or underlying conditions. The issue is not that these treatments are unnecessary, but that their impact on the heart should be monitored more closely over time. Allergy and sleep aids are another overlooked category. Many people turn to these for quick relief, especially when struggling with rest. However, some of these medications can interfere with heart rhythm or cause the heart to beat faster or irregularly. Because they are often used casually and without much thought, their potential impact is easy to ignore. When combined with other medications that have similar effects, the risk can increase significantly. Cold and flu remedies present a different kind of challenge. Decongestants work by narrowing blood vessels to relieve nasal blockage, but this effect does not stay limited to the nose. Blood vessels throughout the body can constrict, leading to spikes in blood pressure. For someone with an already sensitive cardiovascular system, this sudden increase can be enough to trigger chest pain or worse. It often happens during a time when the body is already weakened, making the situation more dangerous. What makes all of this particularly concerning is how invisible the risk can be. Many people follow their treatment plans carefully, take medications exactly as directed, and still find themselves facing unexpected health crises. The issue is not carelessness, but a lack of awareness about how aging changes the equation. The gap between what is generally considered safe and what is safe for a specific individual grows wider over time. The good news is that this risk can often be reduced with awareness and simple actions. Keeping a complete and updated list of all medications, including over-the-counter products and supplements, is a powerful first step. Reviewing this list regularly with a healthcare professional can help identify combinations that may need adjustment. Small changes, such as switching to alternatives with fewer cardiovascular effects, can make a meaningful difference. It is also important to pay attention to new or unusual symptoms, even if they seem minor. Dizziness, irregular heartbeat, unexplained fatigue, or sudden changes in blood pressure should not be ignored. These can be early warning signs that the body is struggling to handle a medication or combination of medications. Addressing them early can prevent more serious outcomes. Ultimately, the goal is not to create fear, but to encourage informed decisions. Medications play an important role in managing health conditions and improving quality of life. But as the body changes, so must the approach to using them. Asking questions, staying informed, and regularly reviewing treatment plans can help ensure that what is meant to protect health does not unintentionally put it at risk. There is a common assumption that danger comes from rare or powerful drugs, the kind that require strict prescriptions and careful monitoring. What often goes unnoticed is that some of the most widely used everyday medications can quietly increase the risk of heart attacks and strokes, especially in people over the age of 60. These are not obscure treatments. They are the pills sitting in kitchen cabinets, bedside drawers, and daily organizers, taken without a second thought because they feel familiar and routine. As the body ages, the cardiovascular system becomes more sensitive to stress. Blood vessels lose some of their flexibility. The heart may not pump as efficiently as it once did, and underlying conditions like high blood pressure or cholesterol become more common. In this environment, even small chemical changes introduced by medications can have a much larger impact than expected. What once felt like mild support for a symptom can turn into a hidden strain on the heart. One of the most overlooked contributors is the regular use of common pain relievers. These medications are often used for chronic discomfort such as joint pain or back issues, which tend to increase with age. While they provide relief, they can also lead to fluid retention and increased blood pressure. Over time, this added pressure forces the heart to work harder, raising the likelihood of damage to blood vessels. At the same time, these medications can influence how blood clots, making it easier for blockages to form in critical arteries. The result is a combination of factors that can set the stage for a heart attack or stroke without any obvious warning. Blood sugar management is another area where risk can quietly develop. Certain medications designed to lower glucose levels may push the body too far in the opposite direction. When blood sugar drops too low, it can trigger a stress response, releasing hormones that affect heart rhythm and blood pressure. In older adults, this response can be more intense and less predictable. What might start as a mild imbalance can quickly escalate into an irregular heartbeat or a dangerous cardiovascular event, especially if the warning signs are subtle or go unnoticed. Medications that influence mood and mental health can also play a role in cardiovascular risk. Some of these treatments affect the electrical signals that coordinate the heartbeat. In younger individuals, the body can often adapt to these changes. However, in older adults, the same effects can disrupt the natural rhythm of the heart. This disruption may not always cause immediate symptoms, but it can increase the likelihood of serious complications over time, particularly when combined with other medications that have similar effects. Allergy and sleep medications are frequently underestimated as well. Many people rely on them for quick relief, especially when dealing with seasonal allergies or difficulty sleeping. Yet some of these drugs can interfere with the nervous system in ways that impact heart rate and rhythm. They may cause the heart to beat faster, slower, or irregularly, depending on the individual and the combination of medications being used. Because these products are so easy to access and widely trusted, their potential risks are often overlooked. Cold and flu treatments introduce another layer of concern. Decongestants in particular are designed to shrink blood vessels to relieve nasal congestion. However, this effect extends beyond the nasal passages and can cause blood vessels throughout the body to constrict. This leads to a rise in blood pressure, which can be dangerous for individuals who already have cardiovascular conditions. A sudden spike in pressure can strain the heart and increase the risk of a serious event, especially during illness when the body is already under stress. What makes these everyday pills particularly risky is how easily they can be combined. It is not unusual for someone to take a pain reliever, a sleep aid, and a cold medicine within the same day. Each one may seem harmless on its own, but together they can create a cumulative effect that places significant strain on the heart. These interactions are not always obvious, and they are not always discussed in detail, which makes them easy to miss. Another important factor is how symptoms can present differently with age. Older adults may not experience the classic warning signs associated with heart problems. Instead of sharp chest pain, there may be mild discomfort, fatigue, dizziness, or shortness of breath. These symptoms can be mistaken for normal aging or unrelated issues, allowing the underlying problem to progress unnoticed. Awareness is one of the most effective ways to reduce this risk. Taking a closer look at what is being used on a daily basis can reveal patterns that might otherwise go unnoticed. Even something as simple as reading labels carefully and understanding active ingredients can make a difference. Many products contain similar compounds under different brand names, which can lead to unintentional duplication and increased exposure. Regularly reviewing medications with a healthcare professional is another critical step. This includes not only prescriptions, but also over-the-counter products and supplements. Adjustments can often be made to reduce risk, whether by changing dosages, switching to safer alternatives, or eliminating unnecessary medications altogether. These small changes can have a significant impact on long-term heart health. The goal is not to eliminate helpful treatments, but to use them more wisely and with a clear understanding of their effects. Everyday medications can provide real benefits, but they are not completely risk-free, especially as the body changes with age. Recognizing that even familiar pills can carry hidden dangers is an important step toward making safer choices. In the end, protecting the heart is not just about major lifestyle decisions or rare medical interventions. It is also about the small daily choices that seem routine but can add up over time. By staying informed, asking questions, and paying attention to how the body responds, it becomes possible to reduce risk and maintain better health even in the presence of ongoing medical needs. There is a growing issue in modern healthcare that often goes unnoticed because it develops slowly and quietly over time. It begins with a single prescription given for a valid reason to treat a specific condition. Then another is added for a different concern, followed by a third to manage side effects or a new symptom. Before long, a person may find themselves taking multiple medications every day, each one intended to help, yet together creating a situation that can place serious strain on the body. This is known as polypharmacy, and it has become one of the most significant hidden risks to heart health in older adults. The challenge with taking multiple medications is not just about the number of pills, but how they interact with each other inside the body. Each drug has its own purpose and effect, but when combined, those effects can overlap, amplify, or even conflict in unpredictable ways. These interactions are rarely tested in real-world combinations, especially in aging bodies that process medications differently. What results is a complex web of chemical activity that can influence blood pressure, heart rhythm, fluid balance, and overall cardiovascular stability. As the body ages, its ability to handle medications becomes less efficient. The kidneys may not filter substances as quickly, and the liver may take longer to break them down. This means drugs can remain active in the system for extended periods, increasing the likelihood of accumulation and interaction. At the same time, the heart and blood vessels may already be more vulnerable due to natural aging or underlying conditions. When multiple medications are introduced into this environment, even small changes can have a magnified impact. One of the most concerning aspects of polypharmacy is how it can quietly affect the heart's electrical system. Certain medications have the ability to alter the signals that control the heartbeat. When one drug does this, the body may adapt. But when several medications with similar effects are taken together, the risk of disruption increases significantly. This can lead to irregular heart rhythms, which in some cases may become life-threatening. The danger is often invisible, with no clear symptoms until a serious event occurs. Blood pressure is another area where multiple medications can create unexpected problems. Some drugs may raise blood pressure slightly, while others may lower it. When combined, these effects can become unpredictable, leading to sudden spikes or drops. A sharp increase in blood pressure can strain the heart and damage blood vessels, while a sudden drop can reduce blood flow to vital organs. Both scenarios can contribute to serious cardiovascular events, particularly in older adults. Fluid balance within the body can also be affected. Certain medications cause the body to retain fluid, while others may lead to dehydration. When these effects overlap, they can place additional stress on the heart, forcing it to work harder to maintain circulation. Over time, this added strain can weaken the heart and increase the risk of complications such as heart failure or clot formation. Another important factor is how symptoms can become confusing or misleading. Side effects from one medication may appear as new health problems, leading to additional prescriptions. This cycle can continue, with each new drug adding another layer of complexity. In some cases, the original issue may be overshadowed by the effects of multiple medications interacting with each other. This makes it difficult to identify the true cause of symptoms and increases the risk of inappropriate treatment. What makes polypharmacy particularly challenging is that it often develops with good intentions. Each medication is prescribed to address a specific need, and patients follow instructions carefully, trusting that they are doing what is best for their health. However, without regular review and adjustment, the overall treatment plan can become outdated or unnecessarily complicated. The body changes over time, and medications that were once appropriate may no longer be the best choice. Awareness is a powerful tool in reducing the risks associated with multiple medications. One of the most effective steps is maintaining a complete and accurate list of everything being taken. This includes prescriptions, over-the-counter drugs, vitamins, and supplements. Having all of this information in one place allows for a clearer understanding of potential interactions and makes it easier for healthcare providers to evaluate the overall picture. Regular medication reviews are equally important. These reviews provide an opportunity to assess whether each medication is still necessary, whether dosages are appropriate, and whether safer alternatives might be available. In many cases, simplifying a medication regimen can significantly reduce risk without compromising treatment effectiveness. Even small adjustments can lead to meaningful improvements in how the body responds. Communication plays a key role as well. Asking questions, expressing concerns, and discussing any new or unusual symptoms can help identify issues early. It is important to ensure that all healthcare providers involved are aware of the full list of medications being used. This helps prevent duplication, reduces the chance of harmful interactions, and supports more coordinated care. Ultimately, the goal is not to avoid medication altogether, but to use it in a way that is thoughtful, balanced, and tailored to the individual. Medications can provide essential benefits, but when too many are combined without careful oversight, the risks can outweigh those benefits. Recognizing the potential impact of polypharmacy allows for more informed decisions and a more proactive approach to health. Protecting the heart requires more than just managing individual conditions. It involves understanding how different treatments work together and ensuring that they support, rather than strain, the body's natural systems. By staying informed, reviewing medications regularly, and maintaining open communication, it becomes possible to reduce the hidden dangers and create a safer path toward long-term health.